Sure. Yeah. Thank you, everyone. And you'll probably hear quite a bit echoed from Karis's presentation. Not only because the St. Louis Community Information Exchange was directly inspired by the work in San Diego, and specifically our partners at United Way 211, who were seeing what 211 in San Diego was doing, and said, how do we implement that here? So I am here talking on behalf of one of the backbones for the St. Louis Community Information Exchange, which is a little bit of a unique model, the St. Louis Regional Data Alliance. We are based out of the University of Missouri St. Louis, and think a lot about health and social service data connectivity, in a way that necessitates effective and equitable community governance, first and foremost, but also needs access to tools and standards and data infrastructure that we also see as big missing teeth. If you want to go to the next slide, just a little bit more descriptive overview of what is the St. Louis Community Information Exchange. Like Karis said, this is purposefully not a technology platform or technology first initiative, but really focusing in on this network of partners, focusing to improve the health and well-being of residents, and more, right, pushing on what are the governing structures that make this a little bit less sort of, buy-in for service providers, and more in response to local community and beneficiary concerns. The conversation started in St. Louis in 2018, again, based on the work that Karis and 211 in San Diego is doing, and really sort of led by United Way 211 saying, hey, we're doing a good job as a call center, but we know that there's more, especially with Obamacare and changes to the healthcare landscape, really trying to respond to those in a community-centered way. So we were launched through funding by the United Way, by Missouri Foundation for Health, which is what MFH stands for, as well as now our local community foundation, all of whom also invest in social services and health equity infrastructure, but needed a way to connect those dots. In addition to us as the data backbone, United Way 211 sort of plays the lead convening role, but also recognized from the beginning that they needed some other partners at the table with additional expertise to really reflect the goals and focus of the CIE as a whole. In addition to us, and I can talk about the data components in a second, we also have the St. Louis Integrated Health Network, which is a convener for FQHCs locally, also participates in a number of statewide conversations, particularly around community health workers, which we think is an essential piece of this puzzle, really grounding that focus on health equity. So founded in 2018, COVID hit, some funders came to us saying, you've been talking about this for a bit. Are you ready to move forward? Now would be a good time. And so we quickly adopted the Unite Us platform, which I know some of you almost certainly have experience with or questions about. We have both as well. But as the sort of technology that would help provide closed loop referrals, although we're very clear then and continue to be clear with them, that this is a community-led initiative that is tapping technology to play a supportive role. We also were founded through community-based organizations and CBO participation. We only had health systems and the two major health systems in the St. Louis region come on board late last year. So we're in the first 6 months of them coming on board, which I think also provides some conditions for success I'll talk about in a second. Around 187 organizations on the platform, 5 counties in the St. Louis region, and we've served over 16,000 people since launch, with a significant caveat that we use this system and platform in collaboration with St. Louis City and County to help provide emergency rental and utility assistance dollars through the CARES Act, which is about 10,000 of those clients. But it still is a really interesting point to make of how people are accessing the services, to what end, across which communities. So that's the long and short of it. I know these are quick kind of palate, not cleansing, but what words escape me. What is the first thing? Like appetizer. There we go. This is just an appetizer for the conversation. But what I wanted to talk about here in the next couple of minutes were how we're thinking about these issues sort of globally. Yes. So if you go to the next slide, as the data backbone, and as folks who are engaged in other components of this work around data and shared data infrastructure, we also realized pretty early on in this process that, what we were talking about when we were talking about community information exchanges and what we were talking about when we talked about community data governance, what was pretty unclear. And so this diagram is from a paper. You can see the link below. I'll drop it in the chat. That was funded through Data Across Sectors for Health, one of their Kickstart grants. We've been a part of a couple of those initiatives, which have been fantastic. Really focusing in on what are the component parts and how do they fit together. And this paper was also co-authored with Open Referral, with Greg Bloom at Open Referral, really sort of honing in on the resource data pieces, but also what we've heard today about community data governance. So again, appetizer, now that I have the words, how do we, right, in these community data sharing initiatives, really focus on how they're impacting communities, how they're impacting service providers, but most importantly, how they're impacting individuals and beneficiaries, and what is the open access infrastructure? What are the pieces that can help connect the dots? So knowing that out of town, yep, last slide here. Factors for success or barriers. One thing that I mentioned before is that this was led by community-based organizations from the beginning, not health systems or a state mandate, recognizing that that's still not the end of the rainbow. We're trying to focus on is the institutional preconditions of social service providers coming to the table and collaborating, which then I think, pushing and moving forward on this being truly community-led. But right now, I think we avoided the first pitfall of having this really come from healthcare, come from a government mandate, which would diminish trust from the get-go. Technology playing a supporting role and not the sort of starring role, both in the 2-in-1 and Unite Us. So trying to center process and people, and then having technology support. And then also this balance, right, of centering local trust, building this, with, by, for folks in the St. Louis community, but also recognizing that we are not an island. And so trying to connect to what's happening at the state level, the federal level, as well as in certain population-specific instances that we've been involved in, particularly around aging services. But the barriers here, as you know, are also immense. We heard some fantastic examples from Pittsburgh and Philly and others around equitable community governance and really, funding and supporting these conversations coming from the community and not just sort of ad hoc engagement over time. But I think what we're realizing is that that's just the tip of the iceberg in terms of the funding and support it will take to have these initiatives be truly community-led. And so where does that come from? What are examples of success? I think we've heard from some of them today, but I think we would also hear that we have a lot of work to do. We need a lot of additional support. Yes, there needs to be adaptation to the local across different communities, but there also does need to be some coordinated infrastructure and funding support. Another quick thing to point out is that social service data infrastructure and standards are, if they exist, they are lacking, and oftentimes they do not exist. So some of the conversation today about health information exchanges, sharing data structured via FHIR, right? That conversation, albeit very imperfect, it doesn't really exist on the social service side. And so how do we develop data standards, for instance, for aging services providers, something we're working on with the ACL as behalf of their ACL Social Care Referrals Challenge is just one example of how do we connect those dots on the social service side, because if not, it's a bridge half built or a bridge to nowhere from healthcare to, and then there's a question mark. And then ultimately, and I think what I'll leave you with is, sometimes taking a step back at the end of the day, there's a question in our mind of what is the system of care that we're really developing, right? What is the vision for how an individual in a community would access responsive, community-oriented, equitable care in a way that isn't just sort of a hodgepodge or a smushing together of existing fragmented and broken systems. And I think really trying to understand what does that ideal state look like, and then figure out how to adapt the systems and technologies to support that vision, rather than what I'm seeing some frustration and some exhaustion around of like, we have a lot of fragmented, broken component parts. How should they fit together and why is that not happening? So I'll stop there. Hopefully that is a good enough conversation starter, and we'll kick it back to you, Mary.